The question we're trying to answer is, why does liver 3, what was the question? Why does it affect liver chi stagnation? So we said we had to go through 6 questions to get there, didn't we? The first question was, what is chi? And we said it's an organisational energy that organises the body, and it's best understood as an electrical force within the body. It's got information attached to it as well. That's really important. It's not just dumb electricity. It's electricity with information. So it's quantum. I hate using that word quantum because you end up with physicists saying you don't know what you're talking about. But it really, like, electricity of information, as far as I'm aware, is basically living in the quantum world. So now, the interesting thing actually is, in Western medicine we do use electricity therapeutically. It's called cardioversion, and in fact, actually, there are types of cardioversion you do where you have to synchronise the shock. So in effect, what you're doing when you synchronise this shock is you're synchronising it to the rhythm of the heart. You're adding information to the electricity. So that's what synchronisation is. So you're adding information, and that provides a better treatment. It provides better treatment because you're putting the electricity in at the right point of the heart cycle, so that then the heart effectively beats more forcefully. So this idea about electricity with information attached to it does exist within Western medicine, but only at the kind of extremes of what we currently do. And what we do with acupuncture is much more delicate, much more gentle medicine. And one of the interesting questions that I think is always worth pondering as an acupuncturist, in fact as a doctor, is how, in the name of, well, name your demigod, can that do anything? Can that therapeutically affect anybody? I mean, this is tiny. Ow. It does hurt when it goes through the skin, but it's absolutely tiny, isn't it? I mean, some of them are practically the same size as a human hair. Now, there's only one force that we know about in our Western materialist reductionist view of the body, or view of the world, that could possibly transmit, that could do anything, and that is electricity. So it's more kind of proof, in a way, of the fact that what we're talking about with chi is best understood as an electromotive force, or electricity. So the next question then, what is chi stagnation? And that was is basically this electricity gets stuck, gets stagnant, and then we moved on to what is normal liver physiology. And the first thing we asked is, what is the liver itself? And the liver, obviously, is the same organ we talk about in the West. It's it looks like a blood clot, and it's connected physically to the gallbladder. But what does the liver do? Because that's the and what the liver does is it takes the blood that's being collected from the gastrointestinal tract, and it's being collected by the heart so that it can be distributed through the body, and it cleans it. It cleans it, and the way in which it cleans it is it has to separate it. So it has to separate the cellular components of the blood, the red cells, from the lymph. And in order to understand that, we need to go into the microscopic anatomy of the liver. So this, as I said, is 1,000th or 1,000th of a millimetre. It's only visible with an electron microscope, realistically. And so we've only known about this, I suppose, in the last 50 years or so, exactly what's happening. And all the electron microscopes you'll see of this are always what's happening in death. So you don't actually see this animated because it's too small. So this is where we got to. So the key aspect of the liver, the key part, is this thing here, which is called sinusoidal membrane. And within this sinusoidal membrane are tiny little holes called fenestra. These are nanometers in size, and these allow the fluid from the portal vein to be squeezed into this space here, called the space of this. And then the hepatocytes here are going to clean up this fluid. That's the regulating part. Yeah. So we've had the draining. So when Wang Juyi's book says dredges, drains, and regulates, the draining is physically occurring across this. It's like these tiny holes, and it's being drained. The fluid's being drained out. Yeah. The dredging is interesting because now, if you've got a copy of my book, actually, there's a Kupfer cell, like highlighted. There's an arrow pointing to this spot here. Apart from the fact the Kupfer cell mysteriously disappeared. I think it probably found some kind of bacteria or pathogen or something and wandered off to deal with it. But a Kupfer cell is a type of white cell that lives here in these sinusoids. And it's very, very dense with these cells, Kupfer cells. And what they do is they're constantly removing bacteria and also large macromolecules, things like cholesterol that are very sticky. And they're removing them from the circulation. So this is dredging. This is the dredging part. Dredging, draining, regulating. Yeah? The draining is this fluid being squeezed out through these holes. And then finally we're left with regulating. So the regulating occurs because these liver cells here take up the parts of the nutrition. It's very rich. It's like a kind of marshy, rich substance that the portal veins absorb. It's full of nutrition, and they take it up and they regulate it. So they might, for instance, take the glucose and turn it into ketones. If the body needs ketones, they might take the vitamins and store them. So the liver stores lots of vitamins, and so on and so on. But that's what the liver cells are doing. Now, in the West, we talk about detoxifying. Yeah. Detoxifying is another way of saying eliminating wind. So this is why the liver is particularly vulnerable to wind, because the wind is abnormal energy. Yeah? So wind is best understood as abnormal energy. You can see wind in ECGs quite easily, and as the ECG gets more like wind, the patient approaches death. So the ultimate ECG of wind is something called ventricular fibrillation. It's just like complete chaos, complete wind. So, we have a basic understanding now of why the liver dredges through the white cells that you can't see here, drains, yeah, and then regulates what's going on. Now, earlier on I said that the liver function really wasn't even understood properly by the West until probably about 30, 40 years ago. And that's because this part here was ignored. So this is the lymphatic system. So the lymph is really the raison d'etre of the liver. It's incredible because the liver used to be described as the portal triad. And the triad was the bile, the portal blood, and what was the third thing? I think it was arterial blood. Yeah, it was a triad, but they completely ignored the lymph. It was like it didn't matter. And then eventually, because as I explained, whenever they looked at the liver, they had to kill the organism's liver in the first place, then they had to fix it. And when they fixed it, all this lymphatic space just crushed down because it was held by fluid. And so they missed this. And it was only recently, say 30, 40 years ago, that they went, oh no, there's 4 things involved in the liver. There's actually a lymphatic system as well. And then, now it's like, well, actually, the lymphatic system is the raison d'etre. 50% of the lymph that flows into something called your thoracic duct, which is part of the Shaoyang, is from the liver. It's an enormous amount of lymph. The liver is constantly producing lymph, enormous amounts of it, yeah? And that's why you get ascites, because when this gets blocked, it fills up the liver channels. And why is it producing so much lymph? Well, because that's the very purpose of the liver. It's constantly squeezing or draining fluid out of the blood so it can clean it up. But then once that's cleaned up, it kind of pushes it out through the lymphatic system. It's just one of the ways it gets rid of it. I suppose it's easier than pushing it back into the blood circulation. So that's our liver, understood in terms of dredging, draining, and regulating. Now, as I explained before, what we really need to be looking at, though, is the invisible world of The invisible world. Now, I wonder if you could just turn the lights on. Thank you. So, now, this is my kind of animation, so apologies if it doesn't look like something from Hollywood. These polo mints are supposed to be the blood cells. And so these are the red cells being pushed down. Now, interestingly, red cells are extremely electronegative on the outside. And also, when fluid goes through a channel, it creates electricity, creates a charge. Good. Strike two. Okay, yeah, the electrical engineer is agreed. And so it creates a charge. Now this, I only just realised this the other day actually. It's like I said, if you want to understand something, draw it. I thought, blimey, so I always thought when the Chinese talks about blood as the mother of qi, I thought that was a kind of, oh, well, blood provides the nutrition so that the cells can then generate qi. But now I'm starting to wonder whether the physical movement of blood is also a big driver of qi as well. It's generating this electricity that the body then uses. So this could be better illustrated, but this entire sinusoidal membrane should be like buzzing with electricity, yeah? Buzzing, absolutely buzzing. I mean, not only is all this fluid flowing through, generating electricity as it does so, but also all of these muscles here. So you can see the fenestra, little holes here, and this is the fluid coming out through these, I imagine it like a jet engine kind of firing out, being squeezed out. So these are also would be governed by electricity. And so this entire thing is running on electricity. You know, I said earlier about like the electricity of our bodies is like, I see it like a grease that keeps everything flowing. So in the liver, I see it like it's just this, you know, it's the same as a electrical engine or anything. It's just keeping everything buzzing and moving the whole time. And what happens with these fenestra, we know for a fact that these fenestra can close. And they will close if they detect things like poisons. And alcohol chronically will also close them. It can actually obliterate these fenestra. In fact, what happens in the ascites is these fenestras all disappear. And so the blood just goes straight through that. Now, it's a bit bizarre, isn't it? Because you'd think, oh, hang on, why is the liver getting all kind of like failing to do its job? Because its job is to take the poisons out of the circulation so that the heart, which this leads to here, doesn't get poisoned. Because the heart is the emperor. So the heart needs to be protected. So the liver's job is to basically clean this fluid so that the heart's protected. But for some reason, when the liver detects poisons, it can basically close. It can close off this process. Yeah, and it will also close on a well, actually that's not quite true. Short-term alcohol will open the fenestra. So getting drunk will open them. Being an alcoholic will close. So not only does this occur at a sinusoidal level, so not only when there's poisons or other things going on, do these fenestra sometimes close, but this entire thing can constrict. The sinusoid is known to be able to constrict down, and the entire liver portal system can also constrict. So what's that? That's qi stagnation. This is qi stagnation at a sinusoidal level. So the electricity all gets stuck, everything clamps down. Yeah, these fenestra with too much static electricity around them probably also get rigid and close, and the whole thing jams up. So the liver's no longer functioning how it should do. The blood isn't flowing through smoothly, and the liver's unable to regulate, and the liver hepatocytes are unable to generate the glucose that's so critical to the body. So the liver is creating all the glucose, basically. And what is glucose? Well, glucose is what all the cells use to then generate, in essence, cellular qi. So if we go back to this picture, we understand that sinusoid was just the most tiniest little part of this liver, yeah? But now on a macro level, so the body's basically a fractal, so everything that occurs on a tiny level also occurs on a big level. So now we see that this entire system is basically starts to back up. Yeah? So the blood in this system. So what happens because the blood's backed up in here? Well, you'll get fluid in the intestines as well. So you'll get edema, you start to get things like bloating, and the gut might not move smoothly, and the stagnation will cause pain. So that's why you get these common symptoms with liver qi stagnation, the bloating, the fluid backup isn't because of the liver, is it? It's the liver invading
spleen.
Exactly, yeah. And that's in the spleen. And then you also get now the failure of the liver to clean this blood properly means that this blood that goes on to the heart, that's the heart there effectively. So the blood that goes onto the heart isn't going to be particularly clean blood. And as a result of that I suspect that's why you get things like headaches as well. Because because the vessels elsewhere in the body, headaches are almost always actually on the surface of the scalp. Don't know if you know that. Yeah, so if people, anything that is occurring the other side of your cranium, the other side of your skull, is a very serious cause of a headache, almost certainly. Things like bleeds, meningitis, hemorrhages. So almost all headaches that people complain of are actually within the fascia, within the scalp itself, or possibly in the neck. And the liver is key in two ways in supporting this. Firstly, the blood itself. A lot of migraines are caused by spasm of vessels. And the other thing the liver is doing is cleaning the lymph, so ensuring that the fascia is well nourished. Because fascia is mainly nourished by lymph. Okay, so hopefully by this point, it's a bit of a whirlwind tour through these questions. So we now understand what qi is. It's some electricity that flows through the body that controls and organises things. We understand what happens when it gets stagnant. It basically stops moving, gums things up. We understand what the liver does. It basically takes the blood from the intestinal system and cleans it and separates it. And then we understand what happens in pathology is this entire system stops working properly, and that causes blood backing up into the portal system and the symptoms there, and also because it's not cleaning and regulating the blood itself, you can get problems with effectively dirty blood and lymph causing tight fascia and headaches, almost certainly from the spasm of these arteries. And also because it's not regulating the sugar levels in your body, you can get emotional lability, yeah? Because, there's even Snicker adverts, aren't there, about like people who are hungry. So it's well known, if your sugar levels all over the place, then you can end up getting very hangry. So now we're up to the, oh God, there's two more questions, yeah. The first question is, how does liver 3 connect to the liver? So let's see how much you've learned so far. So which channel is this of the 6 levels? Schweiyen. Perfect. Yeah, this is Schweiyen. Here you have the pleural membrane. Now, the pleural, pericardial, and peritoneal channels all started as one channel called the coelomic channel, otherwise known as coelomic cavity. All one channel, yeah, and they just grew into it like that. So it was all joined. Of course, because this is the Schweiyen channel. The liver itself grows out of this channel. The sinusoidal membrane grows out of it. And what happens is the channel leaves into the leg in 2 places. Now I'm going to let Western anatomists off on this one, yeah, because when they describe where it leaves, They didn't use channel, but they used a word that was very, very similar. It was the femoral canal and the inguinal canal. And these are perfect descriptions. So you have a look in Deadman. These are perfect descriptions of where the liver channel leaves. Yeah. So the femoral canal is basically exactly 1 finger width from the pulsation of the artery, which is where the liver channel leads into the leg. And it also, in the male anyway, it also goes and surrounds the testicles. And that's the inguinal canal. So in a woman, obviously, it surrounds the womb and the ovary. And they're actually incredibly, you know how important liver blood is in menstrual health. Like the coelomic cavity that I was talking about, coelomic channel, that also makes not only the liver, but it also makes the endometrium of the womb. And it then surrounds the eggs that will be released from the ovary and nourishes them. Liver blood nourishing Jing. Yeah, so it's all there in the embryology. It's so clever. It's just one layer that does all these things. So when you stick a needle in to... so this is the peritoneal channel. Yeah, so we've already seen this. So it's basically, do you see how bloodless it is? It's like completely clear. This is why surgeons run it. Whenever surgeons operate, they want to get into a fascial plane and stay there. And what happens is, inevitably, they're thwarted at some point because of pathology in that plane. Yeah, because that's what pathology does. It gets into these planes. If a surgeon's dream is that the pathology is never permeated across the fascial plane, easy peasy, Japanesey. But serious pathology permeates through fascial planes. So it's the characteristic of cancers, it will go across fascial planes. So anyway, so here we have our liver, here we have our peritoneal channel, here we have our upper end of the Zhuiyin, and here we have the channel going through the femoral canal. This is called the great saphenous vein, and this is the inguinal canal, and the liver channel then perfectly follows the great saphenous vein, which obviously will be a fascial plane as well, all the way down to the big toe, voila, there, yeah, which is where liver 3 is found. So that's our connection. Okay, so we put the needle in there, and we're affecting the chi in a direct fascial plane all the way up to there, goes into there, and eventually gets to the liver. So that's how, because everything in the body, all of the channels are real. They're not, and they're best understood by, you have to get underneath the skin, yeah? Because if the channels were just on the surface of the skin, you would just literally just put a needle onto the skin and that would do it. But generally, most practitioners do go deeper. There are interesting studies where there's kind of little change according to how deep you go, but that's a different issue. Generally, practitioners go deeper. So, now we get to the title of this talk, yeah, which was, why does liver 3 affect liver chi stagnation? And it's been a bit of a whirlwind to get you to this point, but I just love looking at all the names of these, of not only the points, but also the Chinese descriptions of organs. And I mean, for instance, the spleen, if you look at the Chinese character for the spleen, it actually looks as though it's got the pancreas attached to it. So it's drawn as a kind of box with something dangling down, which is exactly how the spleen and pancreas look. So I think the Chinese knew full well that the spleen and pancreas were part of one system, which they are, basically. They're yin and yang of digestion, those two. That's for another day, what spleen does. Very interesting. So Tai Chong, this is so interesting, this Chong, because Chong, okay, who's a scholar of Chinese? Anyone here? Oh,
Where's Major?
Anyone? Okay, Chong, part of my Chinese, if I can't. Chong basically is drawn as as a man carrying two heavy weights, pretty sure, yeah? And it's translated as penetrating, yeah? Penetrating vessel. Yeah, the Chong Mai. Penetrating, do you still call it penetrating?
Yeah, sure.
God knows how that emerged. Penetrating. It was a man holding two weights, yeah? And Wang Zhiyi basically talks about anything but that. He pretty much says pulse. Pretty much. He doesn't quite get there. But he also says that basically it's pulse, in my opinion. It's Chong, pulse. Yeah? Chong Yang, stomach 42 is found on the dorsalis pedis pulse. Chong Men, spleen 12 is found femoral pulse. These two are immensely important pulses in Western medicine. If you've got somebody with a cold limb, the first thing you do is go there, second thing you do is go there. The Chong Mai is the aortic arterial system below the diaphragm. So below Chong Mai, above it, the arterial system becomes it's really simple. What's that?
Daimai? I don't know. Okay.
No. So what? So it's slightly off. Well, it's not slightly off actually, but so above the diaphragm. So okay, the heart. What is the obvious channel that comes out of the heart? There's one. Well, there's a few, but there's one major one. Aorta.
Yeah.
Yeah. The aorta is the heart channel. I mean, it stands to reason, doesn't it? Comes out. Then it splits into the subclavian and the carotid. The carotid splits. One half goes to the brain, one half goes over the face, and they meet at the eye. That's a description of the heart channel. Yeah. Now, the one that goes down the arm, it goes to the axillary, and then it splits and goes ulnar. And this is exactly, where do you find heart 1? By the pulsation. Heart 3 is contraindicated in case heart 2, in case you cause bleeding, the brachial artery. Heart 3 is the splitting. Heart 4, 5, 6, 7 are all found at the ulnar artery here. And why it's following the ulnar artery is because this is the largest branch. It's flowing to the outside as quickly as possible. That's what qi does. It's like electricity or water. It tries to get rid of its energy as quickly as possible. It's just the nature of how things move. So Chong means pulse, yeah? And as I've explained, spleen 12 and stomach 42 makes sense why they're called Chong, yeah? And there's also a pericardium and a heart point that have Chong in them. There's a very interesting triple burner point that has Chong in as well. Guan Chong, it's the last point. The triple burner. The triple burner is a very interesting organ. But why does this have Chong? This is the only other one. Well, and why does it have greatest pulse? Well, because as our electrical engineer, who's been the star of this talk, has said earlier, like, what is going on in this portal circulation? How is that blood being moved through there? And it does actually pulse. I managed to find a study, an ultrasound study, looking at the portal circulation, and it pulses. Very slowly, but it's pulsing. So this fluid going through the sinusoids is being pulsed. And it's a very big circulation. Portal circulation is immense. Yeah, big circulation, pulsing through the liver. And so when you use Tai Chong, great pulse, what you're doing is you're connecting. You're sticking a needle in here that connects to the qi. Now, a source point, it actually pushes qi back into the organ from the channel, according to Wang Zhiyi anyway, and that kind of makes sense to me. So it kind of takes the qi from the channel and pushes it into the organ. So what you're doing is you're putting a needle in here, you're taking the qi of the channel, pushing it back into this organ. The sinusoid is getting a burst of qi that then enables things to start pulsing. I mean, I should really have this pulsing, but it kind of flushes it out. Flushes out this qi stagnation that's bound everything up. It's almost a bit like kind of, if you had the balloon attached to your hair, it would be kind of like blowing all the electricity away. with some kind of explosion, which they do with oil wells and things. And it's flushing out, and it allows it to flow again. In allowing the electricity in the sinusoid to flow, the chi, it also allows the sinusoid, the blood to move properly. And that then allows the liver to function, which means that the portal pressures go down, and so the digestion works better, the blood is clean better, the lymph is cleaner, and so all of the symptoms of liver chi stagnation also start to get better. So that's kind of why liver 3 affects liver chi stagnation, in my opinion.
Is the end?
Yeah, right, any questions?
You said that you might explain why liver 3 as opposed to say liver 2 or liver 8.
Yeah.
So is there what is special about liver 3 exactly? Or is it
It's
just
the
because it's the
source
source
point.
point?
It's the source point.
Because it's the
So
source point.
yeah, no, it's a good question. And so it's the source point. So not only is it, I think it,
the organ.
it's kind of, it's giving the organ more chi.
Yeah.
So I think for some reason the liver stagnation must be, it's like maybe for some organs clearing chi helps its stagnation. I think with the liver maybe it's just that it needs more energy because it's such an energetic organ anyway.
Yeah.
It's like, I mean, the old saying was that you could never have liver chi deficiency, wasn't it?
Yes.
Well, in a way liver chi stagnation is liver chi deficiency because things only get stagnant because there's not enough flow. Yeah, so it's like bang, here's some more energy, you know, get flowing. Yeah. So then, I mean, my other, the only other points I tend to use, actually, I've used liver 8, which was for a very interesting case of knee pain that I thought was actually endometriosis in the knee. It does happen. My wife's like, that happens. But she's an obstetrician, so she doesn't know anything that doesn't occur to her. Sometimes a little bit hard. And, yeah, there's pictures in my book, actually, of the bruising along the liver channel, and this woman just got better so quickly with just 1 point, liver 8. So if you ever have endometriosis, I would recommend considering that point. Now, what does liver 8 do? What kind of point is it?
It's a liver blood point.
Right.
Oh,
Moving the Irish blood.
yeah, I only ever think of points in terms of.
Share point?
I only ever think of it in terms of chi.
Oh, this is a Hussey point.
Because can you see any blood in there?
The brain, yeah?
Oh,
That's the liver channel.
Yeah.
Is there any blood in there?
No.
No.
Like the veins, maybe?
So I never, with my points, might be heretical, but I only ever consider what it's doing to chi in the channel. Or the channel, yeah? If there should never be blood in the channel, it's pathological. And endometriosis, to be fair, is blood in the channel. That's the defining. Endometriosis is blood in the liver channel. And the second most common place to find endometriosis after the peritoneal channel is
Oh, yeah.
the pleural channel.
Yeah.
Why? Because it's a pathology of stagnant and retrograde blood within the liver, which is then flooding into this channel and this channel. And in this case, incredibly, it was also coming down into the leg. And you could see the bruises. Now, it's very interesting, this patient, because when I said to her, this knee pain was episodic and it occurred when she had her period. So that's what immediately made me think, oh, endometriosis, yeah, or something along those lines, or certainly something cyclical in nature. And so I said to her, oh, have you ever had endometriosis? No. So anyway, 10 minutes later, I'm asking her about something else, maybe even a bit longer. And she suddenly goes, oh yeah, I'm asking her about operations. She said, oh yeah, I had a laparoscopy 15 years ago. Oh yeah, what was that for then? Endometriosis. And I think it's a really, the thing is, I mean, she wasn't lying to me, and this was, she'd had an operation for this, yeah? I mean, this wasn't like some kind of throwaway diagnosis that somebody said, you've got endometriosis. She had obviously been through about probably about 10 consultations in total and an operation to get here. It just shows you how unreliable patients are as a source of information. And why I'm a big fan of channel palpation, why I think channel palpation is so good. In this case, I could have just ignored, she might not have told me that, and I could have ignored it. But the fact of the matter was, when I looked at her leg, thank you, I saw these crazy bruises, and the bruises followed a line. Where are you? Yeah, there we are. So the bruises followed, there's liver 8 there. And the bruises followed this line and stopped at the knee. So what was happening was the blood was tracking down. The channel system was doing its job. Yeah, the channel system wants to eliminate pathogens. So it will do that by basically pushing pathogens to the external. So it's pushing this pathological blood out through the channel system. But it was getting to the knee and effectively getting stuck and actually getting into the knee joint and causing severe pain. And so this was the most incredible dirty I've ever had on any patient. I put a needle in there, just one, and she just went, whoa! And she said it went up, interesting, yeah? It went up to her head, all the way back down the other leg to a big toe, I think it was. And then shortly after that, she started crying.
Yeah.
And I was like, oh God, why are you crying? And she said, oh, because I never thought this knee pain could get better, and now I do. So it was pretty powerful treatment, just one needle, that was it. And I think I just used it 3 times. And so liver 8 is good for that. Liver 8's a C point, yeah? So C points are good for retrograde, or actually it's more technically it's called a uniting point, her C point, yeah? And they're good for retrograde chi flow. So that's why I thought that point would be good, because endometriosis is retrograde blood flow. It's blood moving in the wrong direction. And then liver 5, which is found about there, it's probably actually possibly even that vein that goes across. That point I've used for really useful for pelvic pain, actually. It was a woman who'd had coil fitted and then she got this chronic pain, and the doctor said, oh, it's nothing to do with the coil. Even though she had a coil fitted, started getting pain, had it out, and since then she's had pain. And there was actually, again, you can see this in the book as well, the channel changes. There were these subtle channel changes, so I used that point, and yeah, that really massively helped. Liver 3, I tend to use a fair amount, and liver 2, I will use if there's headaches and problems up here. It's better clearing heat, it's more draining. So only really those 4 points, and then liver 13 and stuff like this. So you don't need to good news. Yeah.
Got a couple of questions. When you were talking about the dysfunction of the liver, you mentioned alcohol as the main. Would there be any other factors in terms of medication, or do you know for sure would cause the liver to stagnate more than any other? And are there any people who are kind of prone or genetically free?
Yeah, I mean anything that flows into your. So if we look back here.
Yeah.
So these are the 6 levels. Shaoyin, ectoderm, bladder and skin. This is Shaoyang, lymphatic system. This is Shuiyin. And this is Taiyin, and then the muscular structure around your digestive tube, because it's really 2 tubes, the digestive tube, is Yangmen. So anything that this picks up will, and that effectively is poisonous or wind or heating, will affect the function of the liver. So that can be anything.
So in your practice as an emergency doctor, in terms of liver cirrhosis and all these painful emergency treatments, have you tried liver 3?
Yeah.
Yeah.
Yeah. So the question was,
instant relief for people suffering or.
Oh, liver 3 is amazing. I've used it Yeah, it's an incredible point, you know, because think about it, if anything that's going on in this entire portal system anything that's going on here causing stagnation within this, liver 3 will help move. Yeah, and so that can involve. So this keys into why it's so good for pain. Yeah, so the 4 gates, the mysterious 4 gates. So so in my opinion, like almost all severe pain really is occurring like between here and here. Almost all of it. Yeah, there's something going on viscerally. If you like, I mean, yeah, fine. If you break your arm or leg, it's going to hurt. But generally, when you see people who see an emergency, like apart from trauma, it's all pain occurring between here and here. And so, actually, like a huge part of pain is going to occur because of something malfunctioning within your digestive system. It's enormous digestive system. The liver takes the blood from just about every single organ from here to here. Yeah. Apart from the kidneys. So any of those organs that are a bit stagnant and the chi and the blood aren't moving smoothly in them, it can benefit from basically having this portal flow pushed a bit more, pulsed a bit more. They'll all benefit because it's kind of like, even if it's not the actual cause of the pain, it's kind of like releasing the pressure at the top end to allow blood to move. So at least like they have an easier job getting this like stagnant blood out of for instance, the appendix. You know, which is down
here. I see the
here.
physiology. I just can't quite see someone's going to turn up in the ambulance.
Yeah.
And the doctors would want to put him on the drip.
Yeah.
And then you come in.
Yeah.
And then what's happened next? You go, no guys, give me a needle. And then
Yeah, I've done it.
Is that how it works?
It's amazing.
No.
Yeah.
Okay.
Oh, like if you want to learn acupuncture, go to emergency. Yeah. You see results like that. Just people just get better.
Yeah, exactly.
Yeah.
I was just wondering about
That Western
how
doctors
does
are
it all
open
come
up,
about?
to let you do that.
How does it all come about? Because I've got quite a bit of background in emergency and ambulance and that sort of thing. And
how do you go about doing acupuncture in A&E?
The same way that you
Very
say,
carefully.
It's difficult, yeah.
everybody steps off, you take a needle.
Oh, I've learned
Patients
more.
are
I learned
open
more
to
about acupuncture from not being able to use acupuncture than from being able to use acupuncture.
Right.
So basically, because then I had to use acupressure, which is not ideal because it's a lot slower and a lot more time consuming. But what I learned was the needles weren't important. And then I had to think, well, what is happening there? Is the needle's not doing the magic? And then, it's all about chi stagnation and stuff. But you can, there's studies now showing that acupuncture should be first-line therapy for everything, apart from trauma, bacterial infections, and proper, serious, surgical emergencies and things. First-line therapy, everything.
How do your patients react to that approach and they're expecting to be on the drip for 3 days?
Well, they love it. There's not every patient comes in, they want to get better. They don't care. They don't have the dogma that doctors have. Yeah, a patient does not go, oh, I don't think that works. They're just like, get me better. I don't care how. Get me better. Doctors are the ones who are stopping this.
Well, that's why I'm just
Yeah, I have done it on the side part. So I did it the first time I ever used liver 3 in the emergency department. It was a patient who came in who literally begged me to do something, and I was probably at Kickham actually at the time. That's your qualification. Yeah. When I lose my letters. And then it begged me, and I didn't have any needles, and all I could find was orange cannulas, which aren't ideal. So not orange cannulas, orange needles. So orange are like the tiniest needles you can find, but they're hollow. So I put them in. They're big compared to acupuncture needles. I put them in liver 3, large intestine 4. I think I used 4 gates. I did a lot of acupuncture that I did early days. I did when it worked. It was just kind of luck. but then it gets you thinking. So I think I used 4 gates. I don't know why, but this guy had like he just had liver chi stagnation that was causing his pain. So it was like an IBS type thing, but it was severe. And yeah, he got better and walked out 20 minutes later.
Wow.
And yeah, like I've seen stuff in A&E like that is just, you know, unbelievable. And that's why I'm such a big proponent of using acupuncture in A&E. It's amazing stuff.
I saw one. I know it's just a comment. I heard a podcast about someone in America that he started to use in one hospital, and as an acupuncturist, and it was very well promoted. And I think he started using another hospital. So in America, they might start using for AE patients.
Yeah, no, America's got like a big problem with opioids.
Yeah.
And the acupuncture is the obvious answer.
Yeah.
Yeah.
So they're more.
It's like I'm scathing actually of doctors. I'm absolutely furious with them because they've created an entire class of drug addicts, and it's purely on the basis of dogma. I've taken 2 jobs in emergency on the understanding I would be allowed to use acupuncture. And both times, I was told effectively at the end, no. So I left. You know, and it's like, why? It's dogma. It's frustrating as hell. And it is hell for the patients because they could get better. I mean, I saw a patient who came in with trigeminal neuralgia. And that was when I was allowed to use acupuncture. And it just went like that. I used liver 3, large intestine. This was a classic example. Didn't quite know what I was doing, but it works. And liver 3, so thinking about the points, use triple burner 5. That's a good point for any heat symptoms in your face, yeah? Triple burner, because it just helps. It's a very interesting point. It's the opening point of the yin yang wei mai. And I talk about what the yang wei mai is in my book. So buy the book. And it's a very interesting point. And I think one of the things it does is the yang wei mai is like the microscopic, tiniest little connections between cells. You wouldn't even see them with electron microscopes. They're so tiny, but they do exist. And I think it just opens, well, it's described as opening this up, and I think it releases friction within the body and helps things flow. And so that's why it's good for the heat, because it's like a chi stagnation heat. So I use that, liver 3 and large intestine 4, which just worked on a kind of 4 gates principle. And then what else did I use? I didn't use any local points. And yeah, it just went. And because there was nothing to see, she just came in terrible pain. But this woman, yeah, if I hadn't done that, she was going to go on to carbamazepine and gabapentin. And those are terribly liver toxic drugs. She would have had, almost certainly should have stayed on them for the rest of her life. And should have had to do liver tests every 3 months. She might have gone into liver failure. And it's like,
why?
Why don't you use acupuncture? It worked. Job done.
Pharmaceutical companies.
Yes. Right. Janice.
Yes, thank you. I'm listening to your very persuasive arguments and discussion, for which thank you. And it's making me think, and this sounds tongue-in-cheek, but actually it's serious as well. Would you endorse the liver or the Wood School of Acupuncture, or even the liver 3 School of Acupuncture? You know, it's seriously, because you're presenting such a powerful argument.
Is that a made-up school?
Well, it could be your very own, couldn't it? I mean, there are some people, they say, you know, we're the Earth School of Acupuncture. Do stomach 36 on everyone, sorted.
Oh,
and the thrust of what you presented today, and I know there are other lectures, many that you would and could give, but you are really endorsing, you know, liver 3.
Oh, no, I'm just saying, I'm saying this is how this point works. In terms of, so I'm not saying use this point on everyone.
Wait, but you could be, couldn't you? I mean, I'm getting the impression
I've used it probably on about
influence it has.
30% of. Yeah. I use it on a fair number of people, but it's only because. So the reason I said at the beginning, actually, I think I missed it, but it's a different way to approach. The reason I've approached it this way is because instead of approaching it from the other way, which is in terms of what does liver do what's the channel, what does chi do? To approach it from the point of, as I stick this needle, so it's going from the end backwards, so as I stick this needle in, just before you put that in, it's like, what's this going to do? So it's almost like a flashback type of thing. You know, so now next time you put a needle into liver 3, you'll be like, okay, so it's connecting through the great saphenous vein up here, connecting to the peritoneal channel. The peritoneal channel, the liver grows out of that, and then in the liver it's like basically taking the blood and filtering it, dredging, draining, and regulating, and obviously there's some kind of stagnation, and it's like, you can think, is there stagnation? Is there a better point to use? So to answer your question, I wouldn't have a liver 3 school because there might be better points.
You have given me a broader spectrum for thinking about it.
Good.
Indeed, in these 2 hours, very much so.
Yeah, good. But it's just about all of Chinese medicine is explainable. Well, not only is it explainable, but Chinese medicine is a higher, more sophisticated level than Western medicine. You can subsume Western medicine into Chinese medicine, but you can't subsume Chinese medicine into Western medicine. It's so much more advanced. And this description of the 6 levels, which this basically is this works on so many levels. So you can basically, so there's no limbs on this because the limbs, so the Chinese weren't concerned with limbs in terms of their physiology. They're not concerned with limbs, they're not concerned with the head and the brain, and that's because this system doesn't need a brain. It just carries on anyway. The heart keeps, if you cut the heart off from the brain, it carries on pumping. So it's always doing it. And if you disconnect brain from body, which sadly can occur from like people who have spinal cord injuries, then the body still works fine. It's just you need to feed it and you need to help it ventilate because the lungs are the one thing that needs the muscular movement of the diaphragm. So, but they're just 6 levels. There's just these 6 levels. And what happens is this heart, for instance, then needs something to regulate its pressure. And that's the kidney. So the kidney's main role, see, in the 6-level system, the kidney is actually 2 levels. The kidney is both Shao Yin and Tai Yang. Yeah, so actually what happens is the heart actually sprouts little tufts up towards the skin, which then make nephrons. And then in worms, your wee is released out of your skin. Yeah, a worm wees out of its skin. And what happens is these 2 layers connect. Now, why are they connecting? That's another lecture.